Thank you for joining us. I'm Mike Spence on the TSPN TV News Desk, and I have a special guest today, Ann Platt, the CEO of Sutter Amador Hospital. We're going to talk about the Affordable Care Act, but before we do, we're going to go to a short break, and then we're going to be right back. So please stay tuned, and we're going to come back and talk about something that's of interest to everybody here in our county, the Affordable Care Act, with Ann Platt, Sutter Amador Hospital.
You're watching Amador County's local television network, TSPN.
Okay, well, I certainly...
You don't get your PowerPoint
I don't
presentation
get my PowerPoint
now. We're
here.
going to simplify it today.
You know, it's a very complicated bill, as you mentioned, and I think for most people, reading through 2,000 plus pages of federal legislation is a little overwhelming. So when I go to presentations, I always ask, how many of you have actually read the act? And honestly, very few people have had the attention to read the whole act. I think it's very difficult to grasp. It basically focuses on cost. The cost of care, I don't think anyone would disagree, is too much, that the average citizen has too high of a healthcare cost to bear, and access, that we need to make sure that people in our community have access to care so that they are able to manage their health, avoid catastrophic episodes, and help everyone live a better quality of life.
There are a lot of unknowns in terms of the cost and the access, because these exchanges that are going to be set up have yet to take place, and so people are wondering, you know, what am I going to need to do to sign up my family or my spouse, and how is that going to change? And I know those exchanges are going to be set up at a certain date, and then there are going to be kind of educators that are going to come in and help people to figure out how to sign up. How does that work?
That's the goal. You know, I think there's so many unknowns that it's hard to say definitely this is how everything is going to work. But the concept is the state of California opted to have a healthcare exchange early on. They've been working on it. They now have a number of insurance companies who have bid to be able to sell insurance through the California exchange called Covered California. Here in Amador County, there may be a number of agencies who will have knowledge and support to provide education, as they're being called navigators, to help folks in our community navigate through the new options to them of the different plans. I believe that ATCA, one of our local agencies, is going to receive some support to be able to provide some of that, and Sutter Amador would like to partner with them to help with that. We will certainly have a staff person more knowledgeable than, you know, the average person in how to navigate that system. But
and ATCA being the Amador Tuolumne Community Coalition
Action Agency,
Group, Action
yes,
Agency, and their navigators are going to be showing up at any time coming up in the next few months and helping people out.
Yes, I don't want to speak for them, but that's what that's what I've heard.
And the cost to the hospital is the real key in terms of what's going to be saved, and people don't quite have a grasp on that. I know through your presentation, you know, you outlined, you know, the savings of close to $5 million from annual costs that's expended for people who don't have coverage, and how that would change with more people having coverage. So the hospital will undergo a considerable savings to offset some of these costs too as well.
We hope so. The theory is the hospitals in America have agreed to significant reductions from Medicare, with the understanding that everyone will have some type of insurance, and therefore hospitals hope to not have to provide as much free care as we do today. As a not-for-profit system, Sutter Health has a very generous charity care policy. So if someone receives acute medical care in the emergency room or the hospital, and their income meets certain criteria, they receive a much reduced charge or sometimes no charge for their care. So the hospital bears the burden of that, And now with the health reform measures, we will have a hard time affording to do that if people don't have insurance, because the trade-off is we agreed to receive less, assuming we would have more people who can pay.
Have the coverage.
Yeah.
I guess everybody who can afford coverage is going to have to go out and get it based on your tax returns, and I mean, people
Correct,
have to
or pay a penalty.
or pay
Yeah.
a penalty. That's going to be an interesting test to see how people
Right.
perform there and take responsibility for their own individual health care.
Well, and the penalty may not be as much as it would cost them to have health insurance. So
Right.
I think that's going to be a challenge. That the federal poverty limits are established as sort of a guideline. If you are below those limits, then you receive much more help in purchasing your health insurance.
Well, we should say, too, that the hospital, Sutter Amador Hospital, has been given that grade A rating, and you're in the top 10%
Yes.
of hospitals in the nation.
Well, that's
So
where
you
we
want-
want to be. We strive to be there at all times. We did recently receive that recognition from the Leapfrog organization and from other agencies that have labeled us as an A or a top performer. So,
And I understand that those Medicare costs are going to be evaluated in terms of whether, performance oriented too. So the top performing
Yes.
hospitals will also get a little bit more of a cost reduction, and you should certainly be in that.
right,
set.
hopefully a cost incentive. Medicare has identified certain clinical measures and patient satisfaction measures, and they will pay hospitals based on how well we perform in providing care to reach those benchmarks.
Well, I'm sure you're going to get that discount right off the top because we have
Well-
a fantastic hospital here. And we're going to come back and talk after the break about a lot of the different concerns that our viewers would have, and discuss some more about the Affordable Care Act with Ann Platt, CEO, Sutter Amador Hospital. We're fortunate to have you here. Our residents have a lot of questions throughout the county, and it's just great to be able to address some of those. And I've got a list mile long. I'll go through a few of those, and there are a lot of different concerns, and we'll come back and we'll chat a little bit further about the Affordable Care Act, so please stay tuned.
You're watching Amador County's local television network, TSPN.